So, how are you today?
I'm doing fine. Yeah, actually, my teacher Nelly has some problem.
Mhm. Oh, I
So
see.
I usually have class at 6 in the morning.
Oh,
Yeah,
okay.
but yeah, she's having computer problems.
Technical issues maybe.
Yeah, so yeah, instead IT team called me that she could have class with me. So yeah, so I searched for the another teacher who can
Mhm.
yeah teach me English today, and yeah, I choose you.
All right,
So
thank you.
yeah, that's something happened
Mhm.
today.
Oh, I see. Okay, you're not going out?
Maybe I should go out for the election,
Mhm.
but yeah, but I feel a little bit lazy, you know.
Until
Elections.
what time? Until what time can you vote?
I think until 6 p.m.,
Oh,
but I'd
okay.
rather avoid after 6:30 because, self-isolation people are allowed to have voting at that time
Mhm.
after 4:30. So I'd rather not
Oh,
to
okay.
meet them. Yeah, for my
And
health.
you can you can vote actually at home, correct?
No, I should go for certain places to
Mm.
vote in person. Yeah, still we do not have any um how can I say? Internet voting system or
Mhm.
something. Do you have? Is there any those
It's
kind of
actually
system?
not yet our election time,
Mhm.
so
Yeah, I
and
think
this
so.
so but so I think that would be the new thing that they will implement if there's a pandemic, but because we still have 2 years for us to vote again,
Yeah,
so the term of our
yeah,
president
you
is not
still
yet
have
done.
time. And I think the nations are not that prepared for electrical election because there still has a huge harm for, hackers
Mhm.
or
Yes, you're
yeah,
right.
so those kind of problems would be happen and so people
Yes, you're
can,
absolutely
yeah,
correct.
suspect about the results.
Mhm.
So,
Yes, they might do something, but do you think so? They still have the time? Maybe. We don't
in
know.
Philippines, or you mean the
Um,
election
yes,
of the
they're in your
coronavirus?
country. Yes.
Yeah, after 2 years. Yeah, I think yeah, it will be resolved at that time. I'm in my short thought, I think
Mhm.
a year would be uh needed for handle this corona's outbreak.
Mhm.
Yeah,
Okay,
but
but in your place, how are you doing with the situation?
situation, yeah, uh I usually stayed at home,
Mhm.
but and I sometimes do outdoor activity like going playground with my son.
Mm.
Yeah, that's it.
How old is your son?
5 years old. In Korean age, actually.
Uh-huh.
International age, 4 years old. Yeah, so he cannot
Oh, okay.
stand, yeah, staying at home all day. So, yeah, there are many children in the playground.
Until
and
now.
and yeah, and their parents. Yeah, there's
Oh, okay.
no way to, yeah, stay all of them, make all of them stay at home. So,
Mhm. You're
and
right. Maybe they are also bored.
yeah, and everybody is are wearing their masks, and
Mhm.
yeah, and during the outdoor activity we can relatively keep the social distance
Oh,
easily.
okay. As
Yeah,
long as you do this social distancing with each
yeah,
other, it's okay.
and
I see. Okay. So, do you still go to work?
not today. Yeah.
Because it's a holiday,
Yeah,
because
holiday
of the
for
election.
election. Yeah.
But for a typical day, do you go out and
Oh,
work
yeah.
or do you
Yeah.
work at home?
I work to how can I say? I work out. I go to
Oh,
work.
mhm.
Mhm. And and it's just a 10-minute walk from
Oh,
my
okay.
apartment, so it's quite close.
I see. So you just walk, okay.
Mhm.
So a form of exercise, that's good. And can you tell me more about your job?
I am a doctor, and I'm
Oh, okay.
specialized in radiation oncology. So I'm a radiation oncologist in a hospital. Yeah.
Okay. So is that more of, doing some
Yeah.
oncology is about cancer,
Yeah,
right?
that's right. So radiation oncologist. So I
Use X-ray.
treat
So,
cancer
oh, I see.
patients using radiation. Yeah,
Ah,
it's one of three major cancer therapy. Chemotherapy, surgery, and radiotherapy. So,
I see. Okay. So are you an on-call doctor as well? Do they just call you and come here?
oh,
We need your help.
who?
Are you an on-call doctor as well?
On call on? No, we usually radiation therapy needs lots of facilities. So
Mm,
So we don't have inpatient here in Korea. Well, there are
I see.
some, but the doctors in charge of them is a medical oncologist or the other part. So I don't.
I see. The one that would take good care of them would be a
Yeah,
different doctors,
primarily.
but
So I am in
uh,
charge of radiation therapy. So there's no uh, on-call system usually. Yeah, sometimes, but sometimes there are oncology emergencies happen in emergency
mhm.
room, but it's annual event. Yeah,
Mhm. So it doesn't
yeah,
happen.
yeah, a lot. Yeah,
Yeah, all
so
right.
everybody
Mhm.
doesn't know about their on-call schedule because
Mm.
yeah, I think we
So,
have one, but
mhm.
it's rarely. Yeah, the emergency. There's no a few call from the emergency room during the holidays.
Oh,
Yeah.
okay. So since most of them usually have their schedule already, so
Yep.
you
Yeah.
know,
So you
so
during
you just stick to
weekdays.
those.
Mm-hmm.
Mhm. Oh, okay. So do you have your own clinic or do you work at a hospital?
A large hospital. Yeah. So
Mm.
the yeah radiation oncology is usually located in tertiary hospital, large hospitals. So
Mm.
patients referred to my hospital to get a
Mhm.
cancer treatment.
I see.
Yeah.
All right. So are the patients that you have, are they children? Most of them are children, or they're
No,
also
no, adults.
elderly?
Yeah, elderly.
Mm.
Because, cancer, um, for children, like leukemia. I think
Mhm.
leukemia is the most common cancer.
In
Uh,
children. Mhm.
yeah, but nowadays chemotherapy is really good for them. So some of
Mhm.
them who needs uh, transplantation. I forgot the uh, exact word for blood.
Transfusion.
Yeah, not transfusion. Uh, bone marrow transplantation. Sometimes,
Bone marrow.
yeah,
Uh-huh.
receive whole body radiation as a preparation for bone marrow transplantation.
Oh, I
Yeah,
see.
to
Oh.
uh, to remove the potential cancer cells
Yes.
and some kind of uh, for also uh, quarantine reasons.
Mhm.
Yeah, so but it's very low dose.
Oh,
for
okay.
yeah, for them.
For
So
children.
yeah, for children. So yeah, and the majority of the patients are elderly.
Mhm.
Yeah.
So in Korea, what's the usual case when it comes to cancer?
Uh, well, there are, I think, there are colorectal cancers
Mhm.
are most prevalent, but in for radiation oncology, uh, breast cancer patients are one of the majority. I think one
Oh,
third
okay.
because nowadays most people get breast conserving surgery.
I
Uh,
see.
yeah, so do not in the past if women diagnosed as breast cancer, then
Mhm.
removing the whole breast, whole
Yes.
ipsilateral breast is the standard, but now it's changing. Yeah, you can preserve your breast
Mhm.
and remove the cancer and the tissue around the cancer only.
Those are the
Yeah, only
only ones
removable
that you will.
part. Yeah. And then after
Oh,
that,
I
you
see.
can receive post-operative radiotherapy. Then the result outcomes, oncologic outcomes are the same as the mastectomy. But you
Oh,
can,
okay.
yeah, still have your cosmetic, but better cosmetic effect compared to mastectomy,
Yes.
and
Oh, okay.
less fibrosis on your shoulders. So yeah,
Mm,
that's
that's
the
a
good
great
part.
innovation.
Yep,
Mhm.
yep. And
So when did you learn that? When did that started?
uh, my major, you mean?
No, the one that you just mentioned, the new thing
Oh,
that's happening, the new operation.
maybe I think it's over. It started before. It's just a approximation. 30 years ago. I don't know.
Oh, I
Yeah,
see.
I have to search for the article for the first try, but
Mhm.
yeah, it's quite a long history. So now is the
Mm,
standard treatment for breast
I
cancer.
see. Okay, so it's really something. Sometimes it's alarming that a lot of women, but there are also men
Yeah,
that
there are.
are having breast cancer, right?
Yeah, it's
That's
really rare,
really, yeah.
though. But sometimes, yeah, sometimes,
I
yeah.
just read that too, and
Mhm.
I don't know what's causing it.
Yeah, maybe, maybe, yeah, some weird mutation happened in their breast,
Yeah.
male breast tissue.
Do you think it's also because of our diet?
I don't know. I don't know. I'm not sure. But diet. I think diet is usually related to colorectal cancers. You know, if you eat
Mhm.
red meat a lot, then it can
Yes.
be a risk for them. But in the for breast cancer, it's usually related to exposure to estrogen, the
Estrogen.
female
Uh-huh.
hormone. Yeah,
Yes.
so I don't know why some male, uh, but yeah, also males have some a female hormone, so maybe their breast tissue is quite vulnerable to that kind of hormone level.
Mhm.
Although they are really low level of a female hormone, but yeah, they have sort of natural, how can I say, characteristics for that.
Mhm.
Yeah, that's my assumption.
Mhm.
Yeah,
Your
but
observation.
for
Mhm.
females, like longer exposure to estrogen, such as, no delivery or a single delivery,
Mhm.
uh, and uh, hormone replacement therapy after your menopause.
Uh-huh.
Yeah, the sort of
After menopause.
yeah, sort of things can be a risk factor.
I see. So there could be a lot of reasons for that.
Yep. Yep. Yeah, and yeah, have you ever heard about the Angelina Jolie got
Yes, both of
yeah,
her breasts
preventive
to
surgery.
provoke. Yes,
Yeah, because she has
yes,
BRCA mutation. Yeah, that's the how can I say genetic.
yes.
Uh,
It's genetic. I think her grandmother and mother as well.
yeah,
I think.
and a female who has BRCA mutation has high risk of yeah cancer incident. So
Hmm.
including breast cancer. So yeah, that can be also a reason. So
I see. Okay. Thank you so much for the information that you shared
yeah,
to me this morning.
yeah. Many teacher ask me about this sort of questions.
And it's really, it's really interesting that, especially that you're a woman and you're not aware of these things that you should,
hmm
be aware of. And of course, it's about health.
Yeah, yeah, that's right. So everybody, yeah, has interest in healthy health problems. Yeah, so
hmm And it's good that a lot of people are actually conscious now regarding what they
yeah,
eat
infectious
and
diseases.
being
Yeah,
healthy.
yeah, that's
How
right.
about you? You're a doctor, so are you that conscious too with everyday, with your everyday life?
Yeah,
So,
and I think the most important thing is washing your hand.
mm, especially
Yes.
now,
Yeah,
timely,
so
timely.
that's the most important and yeah, but for the coronavirus, yeah,
Mhm.
social distancing is another yeah factor because yeah, it spreads really uh in fast manner and
Mhm.
yes, just as during a few minutes, if you do
Mhm.
not wearing a mask, then it can spread to the others. So
Yes.
it's quite something. The spreading
Mhm.
power of the coronavirus is quite dangerous. So
Yes, we were just watching it that it is happening in China, and then we did not expect that it's already here.
yeah, yeah. So yeah,
It's
I'm
already here in our
especially
country.
aware of this because there was a patient who got coronavirus in my hospital. So it was a big
Oh.
problem. Yeah, so I I think I should be more conscious about the coronavirus. So yeah, I am a how can I say? Yeah, I'm doing a medical service job. So
Mhm. Here we call them frontliners. But
frontliner.
then, mhm. So, you know, they actually here in our country there are several doctors who already died, and
Mhm.
most of them are, old people.
Mhm.
So, they already have some complications as well,
Mhm.
and some. So I think that's the reason why they got infected too.
Yeah, yeah. So they should wear. They usually say a level D, protection
Mm,
gadgets. Yeah.
to avoid it, and I
Yeah.
hope there are more doctors now, so
Yeah.
that there would be more frontliners, especially during this pandemic.
Yeah. So yeah, I hope everything will settle down soon.
Mhm.
Yeah,
Yes.
I'm also the one who's suffering from Corona Blue. I really go,
Oh.
yeah, somewhere, somewhere else. I want to meet my parents and yeah, parents-in-law also. My friends, I want to
Mhm.
meet my friends. So
You miss them.
yeah, I miss
Mhm.
my ordinary times.
Your usual days.
Usual days. Yeah, correct.
Okay, thank you so much, doctor, and I hope you enjoy your day today. Happy
Yeah.
holiday.
Yeah, happy holidays. Have a nice day.
Have a nice day too. Bye
Yeah,
bye. Thank
bye.
you.